Yeah. Today we will see the median arcuate ligament syndrome. What is this median arcuate ligament and what is the syndrome? This is the complete thoracic cage. The heart is pulsating. You can see the diaphragm here, and I will enlarge the view here. So I want to see the under surface of the diaphragm. So this is the under surface of the diaphragm. This is the central tendon here. The central tendon is, the diaphragm is fixed to the vertebral column by strong ligaments and strong muscles. The muscle strips, they are called as the crura. The crura are, this is the right crura and this is the left crura. And in between the two crurae, there is a ligament, a very strong ligament. This is the ligament, this yellow. So this is the median arcuate ligament syndrome. So we will see for our knowledge what is the medial and lateral ligament. So this is the medial ligament here and this is the lateral ligament of the arcuate ligament. So this is the median arcuate ligament syndrome. So what is the significance of this particular ligament? This is one of the very tough structure of the diaphragm, and because of this tough structure, the diaphragm is attached to the vertebral column posteriorly, and this is the aorta. Aorta is descending in between the two crura, and it is going below the median arcuate ligament, and this is the first branch of the aorta. I will tilt the view. This is the first branch of the aorta, that is called as the celiac trunk. And the celiac trunk immediately bifurcates into three: the left gastric artery, the hepatic artery, and the splenic artery. So what happens in median arcuate ligament syndrome? I will take some help of the tools, select the pen, and what happens in this median arcuate ligament syndrome? This first branch of the aorta, it originates below the arcuate ligament. So the arcuate ligament comes like this, okay, and it compresses the celiac trunk. So this is the thick arcuate ligament, and it is compressing the celiac trunk completely. So the angle between the origin of the celiac trunk and the aorta, this angle decreases. It goes towards the aorta. So usually this is perpendicular to the perpendicularly it is originating from the aorta, but it is compressed because of the ligament. So obliquity and compression of the ligament gives rise to compromised blood supply to all these three branches of the celiac trunk. And because of this ischemic area, the area which is supplied by the celiac trunk, the liver, the stomach, pancreas, spleen, these are completely becoming ischemic, and therefore it leads to various constellation of symptoms, and that is called as median arcuate ligament syndrome.